know that I've worked with a lot of nurses that work on units that are what's it called? Just not the preceptors, the clinical instructors, but they're not teaching at the actual schools. Yeah. Did you do that before you became a professor?
No.
Okay. So you just jumped right, like nosedive.
Right,
you were ready.
Yes.
You knew.
Yep.
Good for you. Okay. So let's jump into being a nursing professor. And I had a nursing professor last week on for my for the Everyday Hero show. So I'm not going to be speaking on the generalities. I said that this one we're going to focus on the skills lab and clinical. Right? Because I had you for both. And I think this is a perfect situation to like air my grievances.
Okay. Go for it.
No, with the general practice of skills lab and clinical. Yep. But let's start at skills lab because that's where everyone needs to start. Okay.
Yep.
Can you just tell me, especially freshman year or for the new nurses, I don't know what it works for every single school nursing curriculum, but for the brand new students that are going to nursing skill lab, what are your goals for those students in that skill lab?
To be safe. Point blank.
Yes.
I mean, safety, that's all we want our nursing students to come out with is that get the grasp on being safe. Being a safe practitioner. That's huge.
Of course.
And the biggest issue I'm having now in Skills Lab because is this evidence-based practice, the research, the most current research. What I'm finding now is in Skills Lab, we might be teaching a skill. It could be on how to do a finger stick, okay? And they might have been taught one way in practice where they're practicing now. Some of them are doing finger sticks.
Yeah, exactly. As nursing assistants, MAs, whatever. Yeah.
And they may have been taught one way in their practice and we're teaching them another way. And so they're questioning it. Well, why are you doing it this way? And it says, well, so we tell them, evidence says, the best research says that, and we give them the rationale and they say, oh, okay, well, how come we're doing it different in our practice? Exactly. And sometimes the research doesn't get to their particular practice
facility,
for whatever reason.
Exactly.
Yep. And so I say to them, well, we're teaching you the right way. We're teaching you the best evidence that, the research that is most current. And I say you can bring it back to your facilities and let them know that this is the best evidence, the most recent research, and see what they do with it.
Yes.
Okay. And hopefully maybe they change their policies. So look up the research and then change their policies. So that's kind of the struggle we're having right now, I think, with a lot of the students that are in practice right now, working as a CNA or an MA or EMT, whatever. Yes. That's kind of the struggle right now we're having in Skills Lab. But the main goal in Skills Lab is that they practice safety. That's
first.
Huge.
Safety first.
Yeah.
So, and I love that answer because, like, I think if those are the goals in Skills Lab, right? Like, just at least the safety one, I'm 1000% about, and like that has to be the goal for every new nurse, every new nursing assistant, anything in healthcare. Safety has to be the number one goal, right? The evidence based is important, I think, especially like understanding the concept of evidence based, because I have to push back just a little bit because as a nurse, the process of something being evidence-based and the time in which it takes to become policy into the facility could be weeks, years, months, decades. I mean, like, and there's something new coming out every single day. So you can't expect the facility or the hospital or wherever you work to get that evidence-based out and running every single time there's something new.
Correct.
Because you would be doing education literally every day 24/7 if you had to do everything based on the newest, brandest, like cleanest research. So understanding that evidence-based is what the nursing schools are teaching you, and you have to understand that that's the concept. Like, you have to understand that we want the best thing for the patient, and if this comes out, this is what we're going to do, and that's what we're going to teach, is the way. I think understanding that concept is very important. But I have to talk about those actual skills. So let's get into the nitty-gritty of these actual skills, because I can't tell you how stressful it is being a nurse. And you are a nurse, and you've been through every one of these processes. So you must understand. And I have to say, like, right off the bat, you were one of the professors everyone wanted to do their skills test with.
This is a riot, because I was talking to one of your previous professors, texting, and I said I was doing competencies last night at my other facility I work at, And I said, they're all lining up. They want me to test them. What's going on? There are 3 other stations. Why do they all want to test with me? So she says, ha, 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 on the text. So, okay, go ahead.
No, I'm just saying, it's because I don't know if you just clearly said it. I couldn't remember if you clearly said it, but you put an ease into the students' hearts where it's like, I understand that you knew this. I understand that this is a little bit nerve-wracking for you, and I'm with you, but like, I got that, especially as a nursing student from you, especially that your only goal was safety, and do you understand what you're doing?
Exactly.
That's it.
That's it.
If you forgot oh yeah, I was supposed to wash my hands. Yeah, I know you're gonna wash hands. Oh yeah, I was supposed to do this before this. I got you. Like, it's not the end of the world.
That's
This
right.
is not a real patient.
You got it.
So like, for all the nursing professors out there, just understand, like, let your students know that you are on their team and you want the best for them. Because, I just have to the honest truth is, every time you were one of the professors there as a skills lab, instructor, everyone was like, I need to be in that line. I need to be in that line. Because we felt it. Yeah. So during those skills testings, right? What do you do specifically to make those students feel comfortable? Like, what are you telling them? How are you going about letting them know that I am on your team and the goal is safety? What are you doing to make them feel that way?
I tell them right off the bat, this is what I do now anyway. I say, first of all, I'm human.
Yes.
I said, just first take a deep breath. You know this. I want them to relax right off the bat when they get in there.
Yeah.
I said, and I don't like to interrupt them. I let them just go with the flow. Just do the whole competency. We call it competencies when they test. Just go through the whole skill when they're testing. And at the very end, if I think they forgot something that's on the skills checklist, I might give them a little hint and say, well, you might have forgot something up in this area here. Oh, yeah. I forgot to do this or whatever.
Yes.
So, that's all it takes. And then they get it.
Of course.
I find that sometimes the instructors, if they interrupt them in the middle, it screws up their whole concentration. Then they get really nervous. They get the sweaty palms and they're like, I don't know what to do next. And then it just gets them all nervous. So, yeah, I just let them go. I tell them, just go through it. I'm not going to interrupt you. Just go through your whole test. And then at the end, if I have to,
we'll talk about it.
Yeah, we'll talk.
We'll talk about it.
Yeah.
I love that approach, and it's probably like the most calming approach, because that's the thing. Like, most people, especially like once you become a nurse, a lot of the stuff, I know as a nursing student it seems confusing and complicated, but as a nurse it just becomes common sense. It just makes sense that you do this step before this step and this step before that step, right? Like, but you don't think about common sense when you're nervous, when you're freaking out, when someone's saying you forgot this, you forgot that. But the calmer the nursing student, the calmer the student, the better the outcome is. So I do have to say, I don't know if this is what you're doing now, right? But there are certain skills that I wish we did more practice with, and I don't know how much say professors have in the deciding on what skills are taught in these skills labs, and it could be a little more intense, but the amount of focus we spend in nursing school on vital signs during nursing school, you might think is ridiculous, but as a nurse, I promise you are going to be thankful for every second you spend doing vital signs.
Yes.
Because you are doing vital signs 24/7, 365 in every scenario. The beginning of the shift, every 4 hours during your shift, when any emergency happens, vital signs, you need to be so for all those nursing students that are like, oh my goodness, I already know how to take a temperature. I already know how to take a blood pressure. Trust me, you don't know how to do it well enough. Please just listen to your nursing professors when they tell you to do vital signs over and over again. That's super important. But the things I wish we spent more time with, and I don't, like I said, I don't know if this is something you have a say in, but are, so wound care is difficult because every wound is different, right? So that one, I give a little push, like a little area of like fidget, like you have space there, right? Because that makes sense because you can't teach every single wound. Cathing patients, especially if you're going to be working in an acute care facility, and IVs. I don't think we spend... I don't know if nursing students need to know how to place IVs because facilities do a lot of that teaching, but I wish that's something I knew. Do you guys have a say in any of that? And what is
How
do you go about teaching the more in-depth things?
Yeah, the faculty do have say. We do. We follow the NCLEX plan,
of course,
and then formulate our curriculum based on that, so that we make sure the students are getting the right education. And the IV piece, like you said, most
facilities, they do
colleges,
do that teaching.
You get that on site wherever you work. Because normally that piece is just monitoring the site. That's all we really do. We don't teach how to put them in. But you're right about the catheters and the wound care. Yes, we do that.
Oh yeah, you do.
And then, we spend a lab on it, you know, and then practice. Everybody has to get into the practice lab and practice it. But it depends on it depends on what school you go to per se, I guess, and how much hands-on I guess you really get, and the requirements. Some have mandatory lab time for, to practice.
X amount of time.
Yeah.
X amount of attempts.
And hours. And some schools have longer lab sessions.
Yes.
Longer lab time in class. In general, the regular class, not just the practice class.
Of course.
So it depends, I guess, how much exposure you get to those areas. I guess you have to research your programs before you get into them.
So last thing on clinical, last thing on skills lab before we jump to clinical, what are your thoughts? How do you feel about the sim lab?
I love it.
You do?
Yeah, I do love sim lab. I'm as a replacement for clinical.
No, not as a replacement, but just as sim lab as like a plus to skills lab.
Yeah, I love them. I love the sims. I prefer to write my own, and then so I can kind of tweak them how I like them.
Yes.
I like that rather than using one that's already, formulated and just plug it in. And I think students like that better too.
Exactly.
When I write my own. Sometimes you can do the voices for the mannequin, and that's kind of fun too. They like that. You can make them as realistic as you want.
Yes.
And I like to see how the students respond, and the debriefing after. You can kind of pick apart what you did well, what you could have,
Of course.
But students do very well in simulation, I think, for the most part.
And ditto. I love SimLab, because when you're in the clinic and when you're in the skills lab and you're working on mannequins that don't have any response, don't have nothing you are working with, like there's no reaction, right? It's everything you do, and then you have to talk your way through these things.
Right.
Yes, of course you need to go through those steps, but the sim lab is literally the closest thing you do get before you get into the actual clinicals. And like you said, when the professor writes their own sim lab situations, case studies, it's much better because the professor knows this group of students are at this place.
Right.
These pre-made sim lab, formats, whatever, they have like just generic things. But like the professor knows these students need a little bit more help on stroke. Exactly. So, but what I wish we did more, and and this is per school, but like this is just my perspective. What I wish we did more were more of the emergency situations, like a brain attack, a stroke patient, or a heart attack, or someone go like little dehiscence, anything that is emergent. But at the same time, it is the facility's job where you work to do the continuing education based on what that facility is. Because like I know when I went to my where I work right now as the cardiac floor, I know that I wanted more heart attack patients in sim lab, but not everyone that I graduated with is working on a cardiac floor.
Correct.
And I keep coming back to that, Professor, because I put so much blame on the nursing school, right?
No.
But it's impossible because you can't teach everything I need to know.
Correct.
You have to teach everything for everyone in that class, right? It's really difficult.
And like I was watching your other interview.
Oh, thank you. You're a kind soul. Thank you.
And how she was talking about the general
NCLEX.
Yeah. So we teach to the generalist, I guess, practitioner. So that's what it is. So kind of like the simulations are safety, communication, and kind of like the basic infection control and all those basic ones. But I see what you're saying. Yeah, it would have been nice to have kind of an emergency one, or the cardiac patient. No.
And
something interesting, something higher level.
Exactly.
Once in a while.
Those are cue the nurse specific requests, and you can't do specific requests when you're teaching to all nursing students, right? So I definitely understand that.